called the silent killer, which is pancreatic cancer, and it's a condition that often shows little to no symptoms in the early stages. Yet it's one of the most aggressive cancers out there. Many people dismiss their warning signs. We'll talk about all of them so that you get to know. Maybe you might be dismissing some of them as well, and then you can know what to do. But we'll hear from two individuals, two gentlemen, and we're going to explore the early detection treatment options here in Ghana and how patients can fully or can live fully after a diagnosis. And that is a very important conversation to have this morning. My guests are two gentlemen. I have joining me over the phone lines Dr. Thompson Quay. He's a medical doctor, and also David Techi is a physician assistant. These are the two individuals I'll be speaking to this morning. Gentlemen, good morning.
Good morning.
How are you doing, please?
By God's grace, we are fine.
Okay, great. Who is this? Is it Dr. Thompson?
Yeah, this is Dr. Thompson.
Okay, all right. David, let's hear from you too. How are you doing?
I'm doing well. Good morning. And you?
Yeah, I'm doing well too, by God's grace. Thanks so much for making time to join us this morning.
It's an honor.
Right, great. So let's start our conversation right away. Now, we hear of pancreatic cancer and people say it's a silent killer. Maybe we can start from there. What exactly does it mean from a medical perspective? Dr. Thompson?
Yes.
Yeah, please go ahead.
All right. So, this morning I want to say a very big thank you to Z Media for giving us the opportunity to educate the public and help us understand this condition very better. So, before I start, I want to say awareness saves lives, and conversations like this are the beginning of early detection and prevention. So today we are talking about pancreatic cancer and why often it's called a silent killer. So pancreatic cancer is a very dangerous disease where abnormal cells grow in the pancreas. So to make it simple for people to understand, the pancreas is an organ in the human body, and it does a lot of things. And sometimes the cells in the body can outgrow and cause cancer. And when these cells grows abnormally, that's when we say this pancreas is cancerous. And it's called a silent killer because normally it shows no symptoms at the early stages. So most people don't know they have it until it is advanced, making it a very difficult situation for health professionals to actually provide help to them. So basically, this is pancreatic cancer and why it is often called a silent killer.
Why is it so difficult to detect early? I mean, compared to other cancers.
Okay, good. So the pancreas itself is a deep organ inside the body, and the early cancer doesn't cause pain or obvious changes, as I said initially. So it makes it very difficult to detect or to see whether the person has pain or comes with obvious changes. So by the time the symptoms appear, the disease is usually really advanced. So that's why it's very difficult to detect very early, because initially they don't show symptoms, they don't come with anything. Sometimes they present with my head is aching me, I have abdominal pain, and initially because we don't have the various modalities, equipment to detect these things, we then treat them as maybe malaria, enteric fever, and they leave. So basically that's that.
So typically, how long? Okay, let me bring our other brother into the conversation, and David, right?
Yes.
Yeah, David. So, do you have anything to add to what has been said so far?
Yeah. So like you were saying, the symptoms are obsolete. Like they are not really there. Okay. And most of the time, even when you get symptoms, you have something like stomach pain, which is people's mistake for a lot of things. Yes. So sometimes people even think it's peptic ulcer, and then they treat. One of the reasons this occurs is because the pancreas itself kind of regenerates. So by the time it cannot accommodate any condition anymore, you're already having your mid-stage symptoms already.
Mm,
Yes. So that's mainly what it is.
I see. And so we're talking about the fact that it takes quite a long time for people to actually detect it. How long does it typically take for people to now come and identify that, oh, this is actually what I'm going through, typically?
Okay, so I personally have heard of just one case where he was treated for peptic ulcer for about 3, 4 years before there was any detection. But
Mm.
typically, mostly depending on the stage of the person and the factors they have, you would get it in older people anyways, but depending on it, you could see it within 6 months and above.
Mm. So which people are more vulnerable?
So mostly would peg it at people about 50 years.
Okay, in terms of age.
Yes, in terms of age. But then some practices also put you at risk, like smoking, drinking, exposure to chemicals. So we'll have the minors and all the people who take a lot of preservatives would be at risk of these things. And also the genetic factors, where someone in the family has a cancer or has specifically pancreatic cancer. Yes. And
Hmm.
then lastly, you could have an issue where um, the person has pancreatitis on various occasions, always has an infection of the GI tract. It transmits, goes to the pancreas, and they have their issues. Recurrence like that will put you at risk of getting the cancer in the pancreas.
So wait, please hold on for us so that we can get exactly what you're talking about. So you're saying that if anybody has a cancer in your family, you can actually be, I mean, you are vulnerable to getting any other cancer, right? That is actually what it is. And even more
Yes,
specifically, pancreatic cancer. So if you have somebody in your family that has cancer, then you might have to be careful, isn't it?
yes.
And you are saying the lifestyle as well. What kind of lifestyle makes us very vulnerable?
So, um, like I was saying, smoking and taking alcohol is one of the things.
Mm.
Um, these kind of practices kind of put a strain on your organs, like smoking, and you know how alcohol is not good for the liver and all those things. Due to the digestive properties of the pancreas, putting these chemicals in your body would cause some mutations over time for your body to try and adapt, and then that will lead to you having pancreatic cancer. One of the things stated also was obesity for people who have excessive weight.
Mm.
Yes, there's also a risk factor of that.
So
And then,
right, go ahead, go ahead.
yes, so and then we are looking at genetic mutations in the body. Okay. In Ghana, mostly the way we detect it to say we say that someone in the family had a cancer. So there's a high risk that that bloodline has a genetic mutation.
Mm.
So we note those or we note those people for being at risk of getting other cancers.
Okay, I
Yes.
see. But how common is it? How common is pancreatic cancer in Ghana? And are we seeing the cases rising?
Yes. So over the years, cases have been increasing, but the difficulty we have is the statistics on pancreatic cancer and the awareness. Okay. So somewhere 2014, they had about 6% of all cancer cases in Ghana being pancreatic cancer.
I see.
And then the survival rate was about 1.5% of the total number.
Mm.
Over the years, this has increased about 2% increments in this. And then it's hard to detect because people don't even present to the hospital knowing they have pancreatic, like for being diagnosed they have pancreatic cancer until it's too late.
Because they are unable to see any particular, or because the signs are quite common, the symptoms are quite common, right?
Yes.
All right, let's talk about the symptoms. And I'm coming to you, Dr. Kui. What are some of the early symptoms every average Ghanaian should pay attention to?
Okay, so as Mr. David explained, most of the things, some of the symptoms are very similar to other conditions. That's why sometimes it's very difficult to point out that this particular person has pancreatic cancer. So normally, some of them come in with yellowing of the eyes and skin, what we call jaundice. Some of them come with unexplained weight loss. Some of them also come with upper abdominal pain that radiates to the back. Some of them come with loss of appetite. Some of them come with dark urine. Some of them come with pale stools. And some of them even come with new onset diabetes, especially in adults above 40 years. So basically, these are some of the symptoms most of the times these individuals present to the hospital.
I see, but so these symptoms are very normal symptoms. I mean, normal things that we feel in our bodies sometimes.
Exactly.
Why is that so? Why is the pancreas actually causing that? I want to see the correlation between the pancreas and some of the symptoms that you have mentioned.
Okay, so for instance, the new onset diabetes, when you have problems with your pancreas, basically is going to transform into this because the pancreas has some cells in it that helps regulate the sugar in our blood. So therefore, if the pancreas is not working well, it will translate to that. Like the person coming with diabetes at the age of 40, that gives us the idea that this person is having some problems with the pancreas. So then we should do other labs to check whether this is not just a mere diabetes, but is the pancreas calling us to actually take care of it. And then with the unexplained weight loss, you see, normally when people have cancer, whether breast cancer, whether prostate cancer, most of them come with unexplained weight loss, and this should prompt us that no, there is something going on in the human body, and then we should actually go in and then see what is really happening in the body. So basically, that's the relation of the pancreas to the various symptoms that we mentioned just a while ago.
I see. And David, you were talking about somebody being treated for peptic ulcer instead of pancreatic cancer, right?
Yes, that was.
So what exactly
So
happened? Is it that we didn't
yes,
have
so
enough technology to actually detect it, or what?
yes, so like he was saying, one of the symptoms is abdominal pain.
Mm.
Okay. And then because you have the pancreas being on the deeper side of the body, it's hard to say, okay, I'm palpating to see whether it's bulging or anything of the sort. Right. So this kind of abdominal pain is mostly around the umbilicus area, almost like an epigastric area pain, which is mostly synonymous with peptic ulcer disease, right? Most of the time, because of the enzymes that the pancreas also produces, it will give you similar symptoms to peptic ulcer, such as indigestion, nausea, vomiting, and most of the time, even diarrhea and other things. So, since these symptoms are mainly related to peptic ulcer, it's hard to tell whether this is peptic ulcer or this is pancreatic cancer falling
Mm.
out to us. And then with the diagnostic tools like the PET scan and the abdominal scans and all that, in Ghana, they're not really so available and not really so recommended by prescribers because of their rarity. Okay. So it's one of the issues we have. There's no regular screening and saying that, okay, this person has an abdominal pain. So let's do an abdominal scan, like an advanced abdominal scan, let me put it, because a normal abdominal scan might not pick the minute changes in the pancreas. Okay. So you might need a CT of the abdomen, you might need your PET scan, and all those more advanced ones, which are not really well known. One, two, they're not really available to people.
All right, I'm going to come back to you on on the treatment options and all of that, so that we can talk a bit more about it. But let me come back to you, Dr. Kui. Now, you were talking about normal stress symptoms and all of that. How can people differentiate between the normal stress symptoms and warning signs of something more serious? Hello, Dr. Kui.
Hello.
Yes. So I was asking that how can people differentiate between the normal stress symptoms that we all sometimes feel, and how can they differentiate between that and the warning signs of something more serious?
Okay, so using the with pancreas, you see, it has eight various works. As I said, as my colleague said, it produces certain enzymes that goes on to do some of the things in the human body. As I said, some of the cells, the beta cells in the pancreas, goes on to regulate our blood glucose in our blood. So basically, if um, there should be a distinction between someone who has pancreas and someone who has other disease, because if we are saying that this pancreas does things like regulating the sugar, they have certain enzymes or certain cells in the body that regulate sugar in the body. It means that they should be presenting with certain things that point us to, let's say, conditions like diabetes, as I mentioned, like the early onset diabetes. So you are there. A certain individual comes to you, a man comes to you, and starts presenting that, oh, I'm 45 years, and I don't have any family history of diabetes, and I've started urinating plenty. I started getting thirsty a lot. Um, then we start thinking that, oh, all right, this is a 45-year-old man who has come to us with this kind of symptoms. So immediately we ran our various labs, in particular maybe our full blood count, our full blood sugar, fasting blood sugar. We check and the sugars are all over the place. We do our HbA1c, and within 3 months the body is not being able to regulate the sugar. So therefore, immediately we start thinking, then it means there's something going on with the pancreas. There's something going on with the pancreas. So these are some of the things that we spoke about, and it will point us to the fact that the pancreas is not working well, and we should take note and help the person. So basically that's that. Just that, as I said, with cancers, there are certain things that are basically in every cancer, like the weight loss, not being able to eat well, they are emotionally drained. These are some of the symptoms, or these are some of the factors that are present in most of the diseases. So someone like with breast cancer may come with unexplained weight loss. Someone with prostate cancer may come with unexplained weight loss. But some of the distinctions, sorry, some of the distinctions, as I said, I mentioned initially about, let's say, someone who comes with new onset diabetes will point us. Someone who comes with maybe nausea, vomiting, it will give us the idea that, okay, we can rule out certain things like the other things and move straight to narrow our diagnosis to pancreatic cancer, and we can offer help as soon as possible to the person. So basically, that's that.
But is routine screening available?
Yes, in our country, the country we are in, sometimes it can be very difficult because, honestly, we are not only tackling pancreatic cancer. So sometimes it can be very difficult. The CT scan is available, but not in various hospitals, making it very difficult for us to actually screen people. Because when you come to Accra alone, I can mention the places that you get CT scan. Even its availability is there, but sometimes the price people can't afford. When you tell a layman to pay like 1,000 Ghana cedi for CT scan, you can know how difficult it can be in this side of the world. So making it very difficult for us, the professionals, and even the patients. So it's really a very big issue that is there, and we are trying our possible best to actually help. So we actually can help in a way. Like today, we are creating awareness to the public,
Yeah.
so that people know that when I start presenting like this, there is a need, there is an urgency to visit the doctor and also talk to the doctor so that we can offer help as soon as possible. Because when it gets to the advanced stages, we will do the CT scan, but what then can we do? We can't do so much. That's why today we are preaching and we are saying that early detection saves lives, and we can be able to get these people early, screen them early, and offer them help as soon as possible. So basically, that's it.
David, do you share in the same problems?
Yes, I think that's the main thing we have in Ghana, where people don't really have the knowledge to even know that okay, this is something that exists in Ghana. So this is a very good way to educate the public on these things. Another issue I would like to add to what he said was the people who have these symptoms are not people who would regularly go to the hospital with their symptoms. Okay, because of the home remedies and all these things, you realize that most patients would do their home remedies. You tell maybe your relative your stomach is hurting, and they'll say, "Oh, take new gel or take neem tree leaves," these kind of things. And then by the time you've tried over 5, 6, 7 times or over those months, you might have even gone to worsen the problem. Okay. So basically, yes, that's what it is. And like you were saying, you can go for a CT scan, and there are so many people going for a CT scan in that small place that is doing a CT scan that you might have to begin given a date in some occasions to come for your scan. Okay. There are quite a few places. There are just a few places in Accra here that do a CT. Okay. So it makes it difficult. And then that's what we are facing. But I think with constant education on these kind of things, people's eyes will be open to some of the things they are having issues with.
I see. Do our government hospitals and so I mean by that I mean Kolibu 37 and some of these Rage and Co. Do they have those facilities?
Yes. So most of the tertiary facilities have these facilities. Okay. But the issue is with numbers. Okay. Mind you that it's not just pancreatic cancer that people do a CT for or do these labs for. And we've all noticed the influx of clients into tertiary facilities. Okay. So most of the time, even the regular checkups will not be able to be done because there are so many emergency cases going to these places. Okay. And then in Ghana, let's say like the case we're talking about, someone comes with stomach pain, he's having a reflux, and then he thinks it's peptic ulcer disease, right? He, the patient himself, can think it's peptic ulcer disease. Even if the health practitioner recommends that, oh, in order to be on the safe side, let's do this to rule out the possibility of these conditions. They cannot afford because of the price. Even in government facilities, it's still expensive.
So just the
Secondly,
screening is very expensive too.
yes, just
The
the screening is
scan, yeah.
expensive. And secondly, they'll get there and then there's a whole queue of people going to do a CT scan. And based on the how urgent it is, like you have emergencies and stuff, you might not get a chance to do yours immediately. Okay. That's these kind of things deter people from doing these kind of labs. I think getting more of these facilities, not just in the government hospitals or not just in the tertiary facilities as well, would help people to be regularly checking on their pancreatic health.
I see. So I want to know that how long does it take people for them to actually, I mean, I want to put it in a different way. So, for instance, people living with the condition, is there like a duration for their existence? I don't know how best to put it, but I don't know if you get a question. Hello, David.
Okay, yes.
Do you get the question?
So we are looking at survival
Yeah,
rates and
survival
then
rate, exactly. That's the point. Yeah.
span of life, right?
Yeah.
So like it's not fixed in stone, saying that okay, maybe once you're diagnosed, you have 5 years, or it's not really fixed in stone. It has to do mainly with, like we were saying, early detection. If it's already advanced and it's already started spreading to other organs, right? There's not much you can do at that front to increase lifespan. Okay. But mostly we say 2 to 5 years, people are able to survive 2 to 5 years with some lifestyle changes, with some modifications in their medications, with some available treatments and all that. But like I said earlier, it's not fixed in stone. It will be shorter if nothing has changed. You're not treating, you're still doing your alcohol, you're still doing your smoking and all those things. But their chances of expanding or living a comfortable life to some extent whilst you're taking your treatment and all that.
Okay. So did you have stories of people who have recovered fully?
So I personally don't.
Okay.
I personally don't because the survival rate is quite low. And then, like we're saying, because it advances so quickly, most of the time, the diagnosis of pancreatic cancer is not actually made. Okay, at the time of detection, people might think of it as a gastric cancer and things like that. So I personally haven't met any case of a successful recovery. But like I was saying, I know someone who went 5 years and is still alive.
Okay.
Okay.
Right.
Yes.
Right. Dr. Quay, do you have a similar story, or have you heard of anybody who was able to survive fully?
Not entirely, because as we said, normally we are not able to identify these people very early. So most of the cases that we see are really advanced. And as my colleague said, because it's advanced, the survival rate becomes so low. And maybe 1 to 5 years is just okay. Because we'll be, even with the 1 to 5 years, it means we are changing some we are doing some lifestyle modifications, giving some drugs, and doing a whole lot of things to keep the person alive because it was advanced. But the truth is that if we are able to get these people early, sometimes we can even treat them and they come back to normal life. They live their normal life, do everything like the way everybody does. That's when we are being able to identify these people very early.
Okay.
So that's what I can add to it.
All right. So we're talking. We're going to talk about quite a lot of things. We'll talk about treatment very soon. We'll also touch on the patient experience. We'll touch on the lifestyle bit of it. I think we've mentioned it in passing, so we'll touch on that very soon. But still on the early detection and the symptoms, I want to know. So, for instance, we've already highlighted the things that, I mean, the barriers to the testing and all of that. We've spoken about the facilities that the inadequate facilities. We're speaking about even the cost involved and all of that. Now, let's say there's somebody that has their own money. They can go to a private hospital somewhere to go and get that test and all of that. How often should they be testing? Dr. Kui.
Okay, so this, as my colleague also said, it's good to come if you have the money, you have the resource, and you come. There is a need. We take you through all these steps, and then we do these things. But you see, in order not to over medicalize things, we have people at risk that we go about, like as my colleague mentioned, those who smoke, those who have who drink a lot of alcohol, those who have new onset diabetes, those who have family history of a pancreas condition. These are the people we target initially. These are the people we inform or we advocate that they come and we do these labs for them. So normally when they come, we can do that on sometimes a yearly basis. This year you come, you meet your doctor, he speaks to you, how are you, asks you of the various symptoms so that we get to ascertain whether the body is working well. And if there is a need to do the scan, we go straight to offer these scans for them. I think I have this one patient that has a family history of pancreatic cancer who comes on a yearly basis for us to do certain labs. So we don't always do the CT scan. Maybe once in a while. I think I've been with him like 3 years, and then he's done the CT scan just twice for me to see the progression of whatever that's going on, because he's high risk. A family member had pancreatic cancer, and we have to take care of this person. So I think within 3 years, we've been able to offer him 2 CT scans. And it's not just CT scan. We have other labs we do, which is very peculiar to the pancreas. And it's been good. So I think it depends on the person. It depends on the person we are dealing with. If the person has no risk factor, we can decide to do it even every 5 years, and it shouldn't be a problem. But if the person has the risk factors like my colleague mentioned, then there is a need to sometimes do it yearly for the person, so that we'll be able to know the progression of whatever that is going on. It's basically that.
I see. So which other labs do they have to go through? And typically, how much does it cost to even do the screening?
The screening as in a CT scan?
Yes. So all the screenings that you say, you do some other labs as well, just to do
yes, we do. Yeah,
diagnosis.
We do some other labs.
Typically, how much does it cost? I know it might differ from hospital to hospital. If you can give us those.
Exactly. So yeah. So with this, some of the labs, they are free. The government will cater for it. Some of the labs, some of them to pay additional money, and then we do it for you. It's not really expensive. The CT scan is the problem, because that's the one that is going to give us the definite diagnosis of what is really going on. The advanced ones is going to tell us that the pancreas is in problem. With the other ones, anytime anybody can pass by, and we can offer those labs to them. It's not so much, but it's something that I think normal income Ghanaian can be able to afford. But as I said, that's not a definite diagnosis. It's just supportive to add to the CT scan. So these are labs that we can offer, and it's not so expensive. The CT scan does mostly the problem always, because of the cost, because of the advanced ways of doing it are not really present in our settings. So that's it.
Okay. All right. So thank you very much. Just hold on for me briefly. Let me announce the phone lines just in case anybody wants to join us. Well, exactly 9:30. This is a business breakfast on Z101.9 FM with me, Nitrebi Hammond. And this morning, I am having a conversation with two medical people, and they are sharing their thoughts with us, and they are telling us exactly what pancreatic cancer is and how to detect it, how to what treatment options are available, and all of that. And we've been speaking for some time now, and they shared a lot of things from the early detection, the symptoms, and all of that. If you just joined, you can still join a conversation. Send us a WhatsApp if you have any questions. 0544321019, 0544321019, or you can call us on 030395661, 030395661, and then we give you the opportunity to ask your questions this morning. Also, we are streaming live on Facebook at ZFMGH and also on YouTube at Z Multimedia. Please do well to engage our post there. You can drop a comment and we'll read them for you and get Dr. Thompson Quay and David Techi to give us answers to them. All right, so let's continue the conversation, and I'll come back to you, David. You were talking about the treatment earlier. I want you to throw a bit more light on what kinds of treatment options currently exist in Ghana for this cancer we're talking about.
Okay, so currently the most common and then most effective that a lot of people are going through is a surgery. Okay, where they have to cut a part of the pancreas that is affected by the cancer and take it off to make sure that they are removing some of the cancer cells. Most of the time, it might not be all because of the rapid multiplication of the cells, the cancer cells. But that's one of the treatments they do.
Is it a Whipple? Is it Whipple surgery?
Yeah,
Okay.
Whipple's procedure. Yeah. Yes. So that helps quite a lot. Mostly you need your specialist to do that. It's mostly done in Kolibu Teaching Hospital, and then Hofanochi Teaching Hospital. Those are the places I know of. Yes, but then there's also.
Sure, go ahead.
There's also chemotherapy and radiotherapy, like all other cancers. There's chemotherapy and radiotherapy for pancreatic cancer. So there are occasions where both of these are done. Okay. So you do your surgery and then you are put on chemotherapy or radiotherapy. The surgery takes a huge chunk of the cells away. And then in order to combat the possibly remaining cells or the remaining ones that couldn't be taken out, you can go through chemo or radiotherapy. The only issue with these treatments is that if it's a late detection, about a huge size of the pancreas will already be gone, then it becomes a problem.
Okay, so the
because
cancer, it doesn't mean that the cancer eats parts of the pancreas.
Yes, so the cancer cells basically just multiply and then feed on surrounding nutrients and other things that they have till they take over the organ or they move on to other places. They're just rapidly growing cells, like typical cells in our body that would regenerate or grow. These ones have a mutation that makes them grow exceeding their limits or unregulated or at a way rapid rate as compared to the normal. Okay.
I see.
And then, like we keep saying, even if two plants are planted at the same place and one is drawing all the nutrients, the other ones will suffer.
Right?
Yes.
I see. So you talk about surgery and also chemotherapy. At what point does a patient need surgery or chemotherapy?
Okay, so these options are helpful in the early stages, like I was saying. So from early to mid stages, when it's detected, most of the time we would want to intervene immediately. We detect that, okay, this is going on. But let's say your CT scan is done and then the whole pancreas is cancerous. Okay, we cannot do a surgical procedure saying we are taking off the whole pancreas because of its functionality. Okay, and the things it does for us. We can't say we'll take it out and then do radiotherapy. We might want to try radiotherapy at those points or chemotherapy at those points, hoping to suppress the growth of the cells or hoping to do away with some of them. Okay. But in advanced cases, most of these things have a low rate of success. So then we just have to manage the patients more of like a palliative care, where we are managing the hormones they are on, the hormones that they need, that the pancreas used to produce, the signs and symptoms that they will have based on the condition. Okay.
Yeah.
Yes.
Okay, I see. So, but how accessible, or maybe still on that we're talking about at what point? But what other factors determine whether a patient is eligible for surgery or chemotherapy? David.
Okay. So yes. So with the factors, so pancreatic cancer mostly occurs mainly in people above 50. Okay. Um, the survival rates based on the surgery has to be considered. Let's say you have a man who is 90 years, has multiple conditions, and is suffering from other things. Okay. And then he has a pancreatic cancer. You have to look at, okay, if we do this surgery, what's the survival rate? Is there 50-50? Would it be beneficial to him? Will it cause more complications to him? Okay. That's one of the things you would want to look at. The other thing you want to look at is how best they can handle the pancreatic cancer before surgery interventions come about. So in early detection like this, we took our lifestyle modifications. If they're able to do the lifestyle modifications and the cancer is not progressing so well, it wouldn't always be an option to go for surgery. You might be able to do your chemotherapy with your lifestyle changes and see significant improvements.
Okay, but how accessible? How accessible? Okay, maybe me one will just hold on. Let me come to Dr. Kwe. Dr. Kwe, do you have anything to add to that?
Yeah, so I think David has explained these things because with the factors that inform the choice of treatment, the little I can add is that, as he said, when we are able to detect this early, we are being able to offer them a form of surgery that is going to help these persons. They are going to then we have a higher chance that after the surgery the person will be okay, the person will be fine. If the cancer is just limited to the pancreas, we can offer these people surgeries. It means immediately we go straight to the cancer, we are going to offer the help by doing a surgical procedure, as you mentioned, which I was very happy that they take care of the pancreas and remove it if there is a need be, because normally the pancreas has various parts. If it's confined to the head, then they do justice to it. But if the cancer has spread to various places, which means surgery alone will not be adequate. That's our situation in Ghana because they come in late and we can't offer only surgery to them because this cancer has spread. Because cancer sometimes always spreads. So if it has spread to the distant organs, then we have to add our chemotherapy to help these people. So in advance, locally advanced cancer, which is not just limited to the pancreas, we then add the chemotherapy or the radiotherapy to the surgery. So that's a little I can add to.
But how accessible? I mean, we talked about how inaccessible the screening is available. How about the treatment itself? How accessible are these procedures we're talking about?
Okay, so in our setting, is there? I think Ghana is doing well. We have these things, and we have the very competent individuals who have specialized in these things. we are being able to detect it early. They can go in and it's very accessible at the tertiary hospitals. So we can be in where I come from, like Takwa, and we offer help like that. We will then transfer the person to maybe Accra, Kumasi, and there are specialized individuals there to take care of them if detected early. The problem comes if the thing has been detected late and we have to offer help to these people. Then it becomes a challenge because we need invasive procedures and other things to take care of these people. So then we start managing these people palliatively to to an extent.
Okay.
So the accessibility is to an extent is there. Is there. Just that our problem now, and that's the main reason why today we are even having this conversation, that if we are able to detect these things early, we'll be able to offer 100% help to these people.
Right.
So basically that.
Okay. All right. So let's talk about the patient experience. What are the biggest physical and emotional challenges patients face during the treatment? David.
Okay, so in the country we come from and the traditions we have, the name cancer alone puts
Mhm.
the person, the name cancer alone puts the person in a very devastating state. Okay, people have their own notations of what a cancer is. You hear people say, "Oh, if you get cancer, dear," those kind of statements. Okay,
Yeah.
so people lose all confidence immediately they hear their diagnosis. Okay, so basically, that's why we like to inform people that as much as it is a deadly condition, there are chances you can take. Okay, you can, there, once there's a chance you can survive, why not take the chance? Okay, this is what we are trying to tell people. Okay, so you have patients who would not want to even go for chemotherapy because they have their suspicions about it and their myths about the therapy. We have patients in Ghana who are scared of surgery. Immediately they hear surgery, they have this panic attacks, this fear, and all those things. Okay. And because people don't even know about the condition, most patients you meet would not even bother when they are having symptoms of the condition or will not take prescribed treatments very seriously because they feel like, oh, maybe what if they were wrong? Okay, that's some of the things that occurs when people don't know about the condition so well. Yes, but
I see.
most of the time, the treatments are kind of radical, let me put it, because when you have your surgery, chemotherapy and radiotherapy have their own symptoms, they have their own side effects that people have to go through. And then for quite a lot of people, having those feelings are not so pleasant.
We'll talk about
Um,
that in a minute. What life really looks like after the treatment. But you mentioned that there are certain myths that surround some of the treatment, like chemotherapy, that makes people want to run away. Would you want to debunk some of those myths?
okay, so in the case of chemotherapy, I've heard one of the common ones you hear is that um, they would give you chemicals to kill your blood cells. I've heard that one before. And then the truth of the matter that is that chemotherapy is mainly done to attack the abnormal cells in your body. Okay. And truth be told, there are some symptoms that would bother you when it comes to chemotherapy, like extra weight loss, loss of appetite, and all these things. But another truth is that most of the time, these conditions that we're treating with chemotherapy already cause these things. Okay. So like pancreatic cancer like this, it would already cause some amount of weight loss or a large amount of weight loss. It would also cause malnutrition because you would have loss of appetites. And since the cancer is feeding on nutrients, the cancer will still cause anemia and other things. Okay. So I would advise people that it's not 100% true to say that the chemotherapy is what is causing these things for you. Okay. Mostly it's the condition that is causing these things, and then your chemotherapy is trying to help with it. Going further, there are a lot of things put in place during chemotherapy that is supposed to make your treatment comfortable. Okay. So like they'll give you your nutritional supplements, they'll give you a good diet plan to nourish you well enough. If there's a need for blood transfusion and all that, they make these things available to you so that you have access to them. Yes.
Okay.
So most of these things are just
right. So Okay, thank you. So let me come back to you, Dr. Kwe. I know emotional support will be very, very important in these times, so I wouldn't let us talk about that. But are there certain survivor networks or communities here in Ghana that patients can actually join?
Yes, I think there are for all cancer groups. There are just that they are not designated for just pancreatic cancer, but there are individuals and groups that are there that offer these helps to them, emotional support to them. Sometimes, as health professionals, we even encourage the family. Those people play an important role in these people's life. We encourage them to offer maximum emotional support to these individuals. And it goes a long way to even help them in their recovery, and also it sustains them. It makes them feel they are okay and they are fine and everything is going to be okay. Sometimes we even encourage spiritual support from their churches, and encourage them with good nutrition and other things to make them feel better and also improve the survival rate of these individuals. So there are these groups around that when these individuals come to us, we introduce them to
direct them
to help them.
Okay, all right. I said we're going to touch on the lifestyle issue one more time, but you already mentioned that smoking and alcohol are two things that actually makes people vulnerable to this cancer. I understand that diet and exercise also play a role. I mean, play certain roles in there. Is that true?
Yes. That's very true, because um, eating a lot of processed or fatty food can predispose individuals to this. From researches, it shows not just for pancreatic cancer but for other diseases. But today we are talking about pancreatic cancer, and there is a link between eating a lot of processed food or fatty food, and it puts these people at risk. And also obesity. I think David mentioned it, that those who are obese are also at a risk of getting um, these conditions. And lack of exercise also can predispose individuals to conditions like this. So there is a need to tell these people, there's a need to encourage these people to stop these things, like smoking, so eating a lot of fruit and a healthy diet, vegetables, staying active. Sometimes it's not just going to the gym. Sometimes it's a simple walk in your vicinity to actually make your nerves work. Be active around your house, not just going to the gym. Maintain a healthy weight, and also limit the alcohol intake. And I think the risks will be reduced reduce to a maximum extent.
All right. So those are things that can reduce the risk. Okay. Our time is almost up, and so we would have to go. But let's touch on what, um, what life looks like after treatment, typically for patients who survive the condition. Of course, you said that not too many people get to survive, but if the few people who survive, what exactly does life look like for them afterwards?
Okay, so like every cancer, I think I've not witnessed one person, or not even one person I've witnessed has come out of it. But I think, like every cancer, um, they feel privileged, and they tend to then the risk factors we mentioned, they tend to pay or adhere to these risk factors, and they limit these things. So therefore, if I know that smoking is going to increase my risk of getting pancreatic cancer, then I, I tend to stop. If excessive alcohol is going to predispose me to pancreatic cancer, I tend to limit it. If not, exercising a lot um, tends to predispose me to pancreatic cancer, I then exercise a lot. So these are some of the lives they live. They live a healthy life, and they try to correct a lot of things in their lives, which makes them at a better place. It makes them live at a better place and reduce the recurrence of this pancreas disease.
All right. Okay, gentlemen, we have to go now. Thank you so much for your time. Maybe finally, David, I just want to wrap up with you. So maybe there's somebody listening to us this morning who is beginning to experience this persistent abdominal pain and unexplained weight loss. What should they do tomorrow morning?
I would say immediately go to your health service provider, visit the hospital, and give them detailed information on the symptoms you are having. Okay. And then even if you have to ask about these things we're talking about, please prompt your healthcare provider. Ask questions. We can answer some questions here, but we cannot answer your questions on a daily basis. I don't think we have a platform yet, but there are health service providers around all of us, and then we can ask questions about it. Okay, so the first thing is always to go ask questions. Always ask questions. If you're not getting the right answers, ask more questions. Okay. Go to prominent websites. You can go to some health facility websites. Private facilities have a questionnaire. Some Hollywood platforms can give you some answers if you get a contact. Okay. But the main thing is to meet a health service provider and ask questions. Okay.
All right.
Yes.
Okay, gentlemen, thank you so much. I'm really, really grateful that you made time this morning to speak to me and to our audience. Really grateful.
We're also grateful for the opportunity.
All right. All right.
Thank
Kindly,
you for the opportunity.
okay, you're most welcome. Kindly enjoy the rest of your day. Right. Okay. So that's it for today on the Business Breakfast on Z. We've had a great conversation about pancreatic acid. Why do I keep saying acid? Pancreatic cancer. Yes, detection. Now we know that it's difficult to detect very early, but you also have to do some screenings from time to time to be able to detect it early, and it lowers the risk as well. It also makes you it also helps the medical practitioners to provide the necessary help so that you can survive. The survival rate is quite low, but it is still possible if you are able to detect very early. So this morning, as we wrap up this conversation, I just want you to know that there is treatment available. There's options. There are so many options available. Your lifestyle actually really matters. Your drinking, if you're drinking alcohol, smoking, your diet, exercising, and all of these things. These are things that makes you, makes you a better person in terms of this particular condition. It doesn't make you suffer it, and so you have to deal with that if you are, and if you are experiencing certain challenges like the symptoms that we've mentioned, you may want to visit a hospital and then speak to a doctor. So don't wait till it's too late. That's how we wrap up today. My name is Nitrebi Hammond. We're back again tomorrow for other conversations right here on the Business Breakfast on Z. Until then, please keep listening to Z. And when you think Ghana, think Z. Well, up next is an inspiring story from the Rise Up Bring project.